30,000 doctors are estimated to have left the country in the last 5 to 7 years, with thousands more exiting in the last few years alone.
Nigeria's healthcare sector is currently facing a very dire situation. This is due to the brain drain the sector is currently facing. Healthcare workers are migrating from Nigeria to greener pastures to seek opportunities. This situation, if not checked, could lead to a very critical situation, in fact, an emergency of healthcare workers in Nigeria. We take a look at some of the critical situation facing Nigeria's healthcare sector, which is exacerbated by poor infrastructure, lack of funding, and of course, some of the basic needs of these nurses and doctors.
My sister, I went to a hospital in the night where I met a midwife conducting delivery using her handset to light. There are states where you see a fresh nurse receiving only 100,000, and so in some places it's even less than that.
Arise News speaks with nurses, laboratory scientists and doctors in the healthcare sector.
In Nyanya General Hospital, our major challenge is light. Light has been a major challenge to us because for me as a medical lab scientist, when we are done with our work and to post our results, before we know the light is out, other facilities abroad, hospitals abroad. When we look at the pay that they give to their professionals, compared to what we earn in Nigeria, it's something else. The difference is it's crystal clear.
When you come into the practice, you find out that just patient care, a lot of things, we know how to do these things, we want to do these things, but facilities aren't there. We have to contribute money to take care of patients. A lot of times doctors pay out of pockets. And when you see patients dying from things that are very preventable, things that are, okay, just take this medication, do this procedure, and the patient will be fine, and patients end up dying. It's very demoralizing, and I think it's a sort of vicious cycle, because the more people leave, the more work is on the doctor remaining. That strains the doctors left, and they are exhausted, they want to leave, and that keeps on. So it's just a vicious cycle.
Nurses and midwives have also thin in numbers, and the doctor to population ratio now hovers around 3.9 per 10,000, below the suggested minimum.
Patients also feel the brunt of the challenges facing healthcare services.
Since 3 days now, no treatment, nothing. To discharge is a problem. We pay money to a lady here. It transfer that money to a different account. Up to now, I haven't get the drugs. Allow me to talk. I'm angry. Up to now, I haven't get the drugs. I'm living without drugs, without nothing.
If you don't enter inside now, you see everything for there now. They don't die. That's why I beg. Help me beg government now. Making open Amak hospital for people there for this country now. You understand, man?
Let me start by saying,
recently, Abuja resident doctors commenced a 7-day warning strike due to poor remuneration without a response from the government.
Each time we go to meet them, they keep telling us the same story. It's not in the budget. Wait for the supplementary budget. For the past 5 years, we've been waiting. We've changed ministers, we've been waiting. We've changed mandate secretaries, we've been waiting.
This led to an indefinite strike. Government hospitals in Asokoro and Maitama were locked down, while the Gariki Hospital saw queues of over 300 patients a day.
Industrial disarmament appears to be the only language the government understands to resolve issues.
We can replicate the same model with healthcare. It's a very simple, pragmatic step, but until we see healthcare as a value contributor and not just as a social enterprise handout to individuals, we will never make that transition.
Imagine a healthcare system without doctors, without nurses, without the number one people who ensure that lives are properly catered to. What would that leave Nigeria? The federal government needs to act, and act immediately. Olije Wapera, Arise News.